What we're going to be talking about is recruitment and retention today. And I kind of would like to have a discussion with everybody out there and kind of what I've seen and what you've been doing to kind of mitigate this situation. Tracy and Kate we're the ones that are going to be putting this on. Okay, I've invited you here today to talk about recruitment and retention in your facilities and to share some information about my observations and research. What we're seeing in behavioral health careers are experiencing challenges all over the state, and it's impacting jails. I'll share some of the challenges and strategies that I observed in my visits to the jails, and then Kate Ireland will follow up after each topic with questions and discussion for current practices. In 2022, I conducted jail visits, and this was just after the time of COVID was just wrapping up. And one of the things, and even though there are 60 different jails in the state, and they all kind of do things a little differently, one of the things that is common in just about all of them is that everybody has recruitment and retention challenges, or at least they did rebounding after COVID. And some of the things that they described were there just wasn't as many applicants to choose from. You used to be able, you called from a register to find out who was on a list of qualified candidates, and you had hundreds to choose from. Now it's less than 10 at a time. And then out of those 10, there's lack of qualified applicants. You know, you do record checks, you do the screening, and then you find out that you have maybe one or two left. Another challenge that we saw that correctional folks are lost to the deputies. Correctional deputies are lost to the road. A lot of folks use corrections as a starting point of their career, and their plan is to go out into the road and become a street deputy. One of the things that the correctional facilities were saying that even though this is a challenge, they kind of expect this, and it's just the way it works. And so even though it does create kind of a hardship, it is something that is expected. Another thing that we see is that people are not making a career out of corrections like they used to be. I heard a stat at a conference that what we're seeing now is that there's 5 years or less that people are devoting to a correctional career. So figuring out why that is probably something that we need to figure out. Why aren't people wanting to stay? Another thing is we can't compete with larger agencies. A lot of things I heard is that people are leaving the county jails to maybe go work for the Department of Corrections, or they're going to work for the Federal Bureau of Prisons. Or in some cases, just even across the state line, other jails or other agencies are able to offer more money. Geographic areas or county city budgets can't support incoming staff. Just the cost of living, people can't afford to commute to places. The housing or renting property is kind of out of their reach. And the same thing with a lot of the smaller counties. We're finding that they're having a lot of lack of housing and places to buy or even rent. People want to get out of the big city, and they're moving out into the counties, and there just isn't the available housing anymore. And of course, according to the budgets, county and city budgets, can they offer competitive wages and to address the cost of living? In a lot of places they can't. Then another thing that comes up is that I ran into this when I ran the competency restoration program at Maple Lane. We no sooner filled one vacancy, we got two more, and it just seemed like I could never keep up, and so I would hire one, and then we'd have two vacancies, and then I would hire two more, and then somebody would retire or quit, or we would hire somebody and offer them the job, go through all the screening, and then we say, when can you start? And they say, well, no, we decided not to take the job. Here we are stuck with starting back over again.
Here we are, our first discussion. So super grateful for all the data and observations that Tracy collected in his time touring the state. And now we're all here, and we're hoping that you all will let us know. I'm a workforce development specialist, so that means that I need to continue to have my finger on the pulse of what's going on in jails across the state as far as recruitment and retention. So I'm looking for you all to let us know, what do you think about the list? It's below. And then are there other things that you might add to this list?
Yeah, this is Devin. I would add that just the perception of corrections as a career, which is down there. And I would speak to budget constraints for larger agencies, because I think larger agencies are willing to apply hiring bonuses or actually throw additional monies at recruiting people, and they're not successful in finding candidates. So I don't think any of these are across the board for everybody.
Right.
And some of the larger agencies have different challenges than smaller ones.
Thank you, Devin. Appreciate that.
I have a quick question. So as far as the number of qualified applicants, I know we saw some changes during COVID, and this is for any of the jails or behavioral health organizations working in the jail. Has it changed at all as far as the number of applicants that you're getting? Has there been any difference?
I can tell you that I've been doing this gig long enough in the recruiting portion that Tracy's absolutely right. In the early double-digit 2000s to the teens, there was you'd have 100 candidates per position, and you'd have your choice. And COVID played its role. It was a different, unique, depending on if your county required or your facility required the vaccine. But since then, there's been more of a presence at recruiting events. We go to PSTs. We host our own 3 or 4 times a year. There's been more candidates. I don't know that it necessarily has to do with the pandemic itself. It's kind of, the bell curve of history, and there's a lot of legislative things that steer people away from becoming in law enforcement, be it jail or patrol, just to be honest, because we do the recruiting for patrol as well through our jail. I don't know that, especially in the rural part of the state, that the pandemic played any role in that. There was a lot of competitive job opportunities, and then you look at generational and the opportunity to telework, work from home. I don't know
Right.
what that means. That might have been the only thing, and is the difference in the environment and the generation of them.
That's a good point. It could be that just times have changed, and people would rather have remote jobs or something that's a little less demanding.
Well, I think the remote jobs just escalated after COVID. I mean, there's way more opportunities to work remote than there ever were before, so that could be an indirect impact.
All right. Well, thank you, everybody, for contributing. Let's go ahead and move forward. One of the things when I was touring around the state, correctional officers were tough to recruit for. We also, the mental health field, mental health professionals were also difficult. A lot of jurisdictions had no DCRs available. And it's like, it's not that we don't want to come out to your jail. We just don't have anybody to come out to your jail. And then also health services. When I talk about health services, I'm talking about nurses, physician assistants, physicians, just people to handle the medical portion of our work. A lot of times there isn't anybody except the hospital on the hill or around the corner. And so these are the main professions that appear to be affected by these recruitment and retention challenges.
We're back at another point of discussion, but I want to just make sure that we called out that Ginger did share that people want hybrid jobs versus straight office time, which other folks certainly agree with. So thank you, Ginger, for sharing that.
I was just going to say that there is one more challenge. When you can find somebody, that is having other systems be ready for them. So for corrections officers, we have to go through an academy, and there is an incredibly long wait time for new employees.
Oh, yeah.
So we're all competing for that same resource, and it's a delicate balance of when to hire in order to get them into an academy, or without that training early on, some people lose interest, or worse, they're in a position they're not prepared for. So that it's just one more layer of complication for corrections officers.
Yes, very true. Thank you, Devin.
Yeah, really appreciate you coming off mute and sharing that, Devin, because that's huge, and I didn't see that so on our list. So that's super helpful. Thank you. So looking at what Tracy just discussed about specific positions being challenging and having a high turnover rate, namely corrections officers, which Devin just led into why that might be part of what we're seeing in mental health professionals and health service folks. Is there anything else that you, or any other positions that you see as challenging in your location that perhaps we haven't listed, or general thoughts about the list of folks that have been listed?
Yeah, I'll just give you a heads up. Again, and I'm coming from the rural side with a pretty fat budget for programming and medical services. Traveling nurses are killing small communities, hospitals, providers, and then jail or other facilities that need nurses. You can't afford nurses because of what traveling nurses are making.
Wow.
Mm.
And I have that as a solution for dealing with shortages as traveling nurses. So at the same time, it sounds like they're also challenging people's budgets as well. Wow. I know there's some facilities that hire social workers or transition help, transition workers, maybe peers. What about some of the other type of jobs that we're now that are springing up in our facilities? Any other positions are difficult to hire for? Clark County had a transition coordinator they were hiring. I was wondering if they end up hiring that person and whether they had any challenges. But okay, go ahead.
I will just say, as somebody who's been trying to recruit an HVAC professional and IT staff for a long period of time, it is really all positions in a corrections setting, because those same positions go through the same level of scrutiny and background checks to be able to work in a corrections setting. So it's not just the traditional inmate interacting positions, but if you're working in a correctional setting, then you're going to have additional layers of security, and that's been a real barrier for some of our other non-custody positions.
That's a great point, Devin. I know that nurses that I've interviewed, I said, did you ever think you would work in a jail? And they said, no, I wouldn't. In fact, now that I am, I love it. The facility was nice. They liked the people. They liked that everything was very organized. And even, teachers working in prisons or dentists working in prisons and it, I think sometimes we just don't advertise enough that, it may sound intimidating working in a jail, but the only thing they know about jails is what they see on TV and what they learn from the media. So maybe one of our challenges that we could do is how do we promote our profession and our facilities as a, safe, comfortable place to work.
Ginger, you have your hand up?
Yeah, I was going to say, and I think it's been said, so I apologize, but mental health professionals within the jail setting, that's a difficult one, but so are psychiatry positions, and there's so few of those across the jails. I mean, we have one that'll share several different facilities, and so being able to find somebody who can be on site or give us enough time to be able to utilize their services has really been challenging.
Thank you. I bet. Hey, last year, I had the opportunity to go to Philadelphia and at an ACA conference, and I went to a workshop, and it was called Filling the Void for Correctional Officer Vacancies. And the presenter was the chief of HR. And in this workshop, they focused on a number of recruitment strategies. And this workshop examined the severe shortage of correctional officers across the U.S. and the impact the shortage are having on these facilities. This workshop focused on 3 different agencies and the things they did to address vacancies. A strong effort was placed on recruitment strategies. And in Washington, several jails are already implementing some of these. And let's talk about some of those. So we have offering hiring bonuses. I noticed that a lot of our jails are offering bonuses based on meeting working milestones, 3 months, a year, or 5. A number of facilities are currently doing this in anywhere between $3,000 and $5,000 hiring bonuses. I know some mental health positions are fetching up to $10,000 in bonuses. I just saw Federal Bureau of Prisons was advertising, and they were offering a $10,000 signing bonus as well. Another bonus that we could that if you had it in your budget, offer bonuses to staff who recruit people that they know. So if your staff are actually helping out with recruitment, see if there's a bonus that you can offer them. Another recruitment strategy is take a look at work hours. Are you able to offer different shifts? We got those 12-hour shifts. We have 4 10-hour shifts. There's the 980s. There's also rotating shifts. Lowering the age of recruitment, 18. Several jurisdictions are against this, but even looking at our own state, I encountered at least 4 county jails who have already done this. I am interested in, or is anybody on the call that actually have changed the requirements to 18? And if so, how is that working? While you guys are thinking about that, I just read an article on LinkedIn this morning, and an intern from a college was actually charged with bringing in contraband into a jail. And one of the comments was saying, why would anybody bring a 17-year-old college student into a jail to work? And one of the things I said, because of recruitment, and I actually responded to the comment and said, well, people are having recruitment issues and they're lowering the age to 18. But what we're seeing is nobody really, in my experience, nobody is in college and says, I'd like to have a career in corrections. It's something that they usually maybe fall into and have found and realize that it's a good profession. But it seems like it's really not, corrections is really not promoted in colleges as maybe it should. And so here was a place that had a college that was willing to offer internships in a local jail. Well, if you're going to do that, you got a responsibility that, there's that manipulation that the population can do. And they're experts, and to put a 17-year-old in the middle of that, that's just kind of crazy. So, if you are going to bring in younger staff and or even have younger interns, make sure they're properly supervised and make sure they're trained, especially in the art of manipulation. Any thoughts on that? How does this group feel about lowering the hiring age to 18?
I just can only speak from the mental health side of stuff, but I think that would be very stressful pretty much for the answers or the reasons you already gave. I know that like even our department a few years ago had people walked out of their desk for, crossing boundaries, and were fired. And they, were 21 and older. So, I just think that inmate manipulation is always a very big issue, if you will, or thing to always keep in the forefront of your mind. And then, and I also feel like part of that, I guess this is my own thought, but part of that comes from maturity and just awareness. And not that you can't be mature when you're 18, because obviously there's some very mature people at all ages, but that would stress me out. Just in my role in mental health and not in security. So
Yeah, I remember when I got out of college and I thought I could work with juveniles and I would save the world, and I worked in a juvenile facility and here I was 21 and the residents there were closer to my age than the staff there were, and trying, and technically, they were able to eat me up with, how they're, and unless you're on your toes, it was a good training ground. And even at that age, being in a juvenile facility was tough. And so I couldn't imagine being in an adult jail and also not being supervised as well as maybe as you should have. Okay, let's move on to another thing. A recruitment strategy is recruitment efforts. And so, let me see here. Offering, let's see. In some places, if you have the luxury, maybe designate a specific staff just to focus on recruitment, or hire or collaborate with other organizations for recruiting efforts. Attend job fairs and colleges, and just take more of an active effort in recruiting folks. Another thing that they talked about at this conference workshop, they spent a lot of time on this, and they talked about updating your position descriptions and how jobs are advertised. I know that when I was running the competency restoration program, we were so behind. Well, there were so many vacancies that we just had to get something out there. And we knew that these position descriptions weren't the best written, but we were just reacting. We didn't have time to go in and change things. And so we wondered whether or not we were really appealing to the people that were reading these announcements. And so these are some of the things that they talked about with job descriptions. And we're going to I'm going to show you a few examples, and we'll have some discussions over that. Okay, this was actually a job description that was one of our county jails, and it was in a paragraph form. And so I broke it up so we can, see it a little bit better, and I underlined things that maybe we could change. And the things they talked about was avoid using labeling language and how we deal with our population. That topic is getting a lot of attention. It has for many years, trying to do away with those terms that actually labeling people. And then also that we maybe, when we're doing our position description, think about what kind of skills are we after. Describe the sought after skills such as the ability to mentor, to collaborate, being a fast learner, performs well under pressure, etc. And then also focus on the training to ensure that new recruits are better prepared for the job. I mean, they could read these things and say, wow, that's a lot of stuff. How am I going to learn all this stuff? I'm feeling a little leery about, applying physical restraints, and so sometimes we maybe could be freaking people out just by them reading the position description. So when we look at this example here, I'm just going to read it out loud here. Receive and books incoming prisoners. Verifies that proper documents are submitted. Receives and safeguards inmates' personal property and valuables. Search prisoner for weapons and contraband using pat-down, metal detectors, and or strip procedures. Inspect for injuries, fingerprints, photographs. Ensure the location and wellness of inmates. Conducts periodic checks of floor and cells to verify proper conduct of inmates. Search cells for contraband materials. Moves inmates within the facility for visitation, exercise, recreation, court appearances, church services, and school. Controls inmates through verbal communication and, in some situations, physical restraint. Responds to emergencies within the facility and may be called upon to administer first aid and evacuate inmates. Dispense meals, retrieves meal trays, accounting for all utensils, prepares written, typed, or computerized logs and reports, and administers the release of inmates. Okay, as you can see, I mean, it's very thorough. I mean, it describes everything that a correctional deputy or officer would do. There's nothing wrong with this, but, it could be a little vague. It could be a little scary. So based on the recommendations of this human resource person that did this presentation at ACA, these are some of the things that based on those recommendations, I took a stab at this to go ahead and change it up. So we're going to take a look at maybe rewriting this job description.
So Tracy has presented us a little exercise, looking at the previous language and then a demonstration of what alternative language might look like. We just looked at a bunch of things that were underlined as not the way to go. So giving you a tool for better language is what we're looking at doing. So is there anyone that's willing to read the previous language for that first square in the upper left?
I can read it.
Thanks.
Thank you.
Cool.
It says, receive and books incoming prisoners, verifies that proper documents are submitted, receives and safeguards inmate personal property and valuables, fingerprints, photographs, ensures location and wellness of inmates, inspects for injuries, prepares written, typed, and or computerized logs and reports, administers the release of inmates.
Thank you.
All right. Thanks, Whitney.
Yeah.
Okay. So I took a stab at changing that up a little bit. It's a little bit longer, but I hope that it sounds a little bit more, I don't know, something that would interest me more or interest our readers. So I said, initiate intake procedures of all people being admitted to the facility, which includes gathering of personal information, including fingerprints, collect and inventory personal effects, screen for medical and behavioral health issues, explain facility rules, classify and place in appropriate housing units, documenting information collected, and reporting out as needed. Using database to input and retrieve information, assists and collaborates as needed to prepare for transition/reentry.
Awesome. That definitely reads different to me as I'm listening, Tracy. So thank you for your efforts to make that a little more user-friendly and reader-friendly. Does anybody want to read the previous language in the bottom left corner, starting with searches cells?
Sure. So searches cells for contraband materials, searches prisoners for weapons and contraband using pat-down, metal detector, and or strip procedures, controls inmates through, in some situations, physical restraint, conducts periodic checks of floor and cells to verify the proper conduct of inmates, moves inmates within the facility for visitation, exercise, recreation, court appearances, church services, and school.
All right, thank you. All right. Maintain safety and security practice for residents and facility personnel, which includes adherence to contraband policies, conducting routine body searches, operate body scanner, apply mechanical and or physical restraints as needed, conduct routine residential counts, cell searches, and monitor movements to recreation, visitation, medical appointments, court hearings, and other facility programming.
I don't know that I'd put body searches on there because that might scare a lot of people away, and they're becoming less and less, especially if you have a scanner in your facility like we do. So, I mean, my suggestion may be just appropriate searching, something along that lines, because, if you tell somebody straight out, oh yeah, in your job you're going to strip search 100 people a day, that might be a turnoff.
Agreed. In fact, I noticed that on some, it used to say, I still see descriptions saying that strip searches and a lot of the new jails, a lot of the jails have got these body scanners when they're not doing strip searches anymore because of that. So yes, good comment. Thank you.
Does anybody want to read the previous language upper left?
Responds to emergencies within the facility and may be called upon to administer first aid and evacuate inmates.
Okay, so administer first aid. Again, I think the potential applicants going to want to know that they're going to be trained in first aid. So maybe throw that in there. Trained on first aid and emergency procedures to effectively respond to urgent and emerging needs within the facility. So kind of bring some attention right to the training that they would be trained in first aid. Okay, let's just do this last one here.
Controls inmates through verbal communication and dispenses meals and retrieves meal trays, accounting for all utensils. Conducts periodic checks of floor and cells to verify the proper conduct of inmates.
Thank you.
Okay. All right. And so I changed that up a little bit. Able to monitor and enforce facility rules with residents using verbal techniques such as motivational interviewing and crisis intervention strategies. Demonstrating and mentoring pro-social skills by interacting with the population daily, assisting with meals, programming, and social events. Training includes on-the-job training, successful completion of the Correctional Academy at the Criminal Justice Training Commission. Again, pointing out the type of training that they'll be receiving, so they know that they're not going to be going in there with their eyes closed or open, and that they're not going to have training to assist them. Okay, this I took from the Department of Corrections, and I'll read this real quick. And they've gone through and redid most of their job descriptions, and listen to for some of the suggestions that were mentioned earlier actually in here. In an adult correctional facility, correctional officers provide safety and security and assist in controlling, directing, and monitoring the activities and movement of incarcerated individuals. This includes maintaining security of the institution and controlling movement into, out of, and within the institution in accordance with established department methods and procedures. Correctional officers are expected to be positive role models and work with the incarcerated individuals to help them become productive members of society from the day they arrive under supervision. Correctional officers use interpersonal skills and good communication skills to correct and counteract criminal thinking while maintaining safe confinement environments for the individual to pursue the successful reentry into communities. The successful candidate for Correctional Officer 1 will possess creative thinking, self-confidence, strong role modeling, and good physical and mental conditioning. Overtime is an essential function of this position. Correctional officers must successfully complete Correctional Worker Corps, a 6-week academy for all correctional workers employed in DOC prison facilities. We know that managing difficult people takes more than force. It takes observation, knowledge, skills, and continual practice. Every DOC employee is provided with initial training designed to help assure safe working conditions and will continue to get the on-the-job training throughout their employment. Okay, so you can see that it's modified. It's a little bit more open. It talks about the training. It talks about the different types of skills you're looking for, that professional, and then it avoids the labeling conversation or the labeling language.
All right, back to the group. So after all of what Tracy just shared, are there any folks out there who have rewritten or looked at their job descriptions or postings, or any folks who have used any recruitment strategies other than what's listed below that you would like to share with us all?
Well, I can tell you that it's a dog-eat-dog world out there, and these PST training or testing sites are now your mobile job fairs, and we have a dedicated recruiting background deputy that we've incorporated to send to job fairs. We have a college right in town with a criminal justice degree.
Excellent.
Yeah. And so we do all of those, and we send them to PSTs, and we've also incorporated him doing backgrounds to increase the time from the testing to the interview to the table. But then we run into the same problem that Devin talked about, waiting for the academy 10 months down the road. But some of those things are good. I won't speak on behalf of changing age requirements. We haven't at our level yet, or at our agency. There's some concerns, but I can tell you also, as a father of a good one, there are good 18-year-olds out there, and there's bad 25-year-olds out there. So I have to kind of confirm what Whitney said. So I think that would become more of a case by case, and we're kind of watching what other agencies in the rural area do as they lower it to 20 and 19 years old, even some of the bigger agencies. But rural's a different breed because you don't get assigned to an area, you get assigned to a jail. I mean, so they've got to be multifaceted in all their skills. Job descriptions, I don't think that's as much a problem as much as getting these people in for a tour and opening the door and letting them see what actually looks like inside a jail, because TV's not real. We can't compete at hiring bonuses. We do have a recruiting bonus in our union, and I know that there's some I-5 candidates or agencies that are looking at this for their candidates and their unions, because we've had those discussions. But and then the other thing for me is work hours. I'm not a fan of shift bidding, and that's something we've never done at our agency. So it's a plus if the people can rotate rather than get stuck on night shift for the first 8 years of their career.
Right.
I will tell you, though, that DOC job thing that you posted, they need to send that person that wrote that to generational training, though, because today's workforce coming up out of college does not want overtime. They want to do 40 and go home. And if that's the essential function, they're turning away a lot of candidates.
Yeah. Yeah, you wonder whether or not that was written either post-COVID or during COVID, because I know that DOC in a lot of places were they were killing their workforce by the overtime. Excellent comments. Thank you.
I want to add, Tracy, if I could, two things that we did. We have a few staff who are prior military or veterans also go to our military bases to recruit during their recruitment affairs. And then we have those same staff will mentor any applicants throughout the whole application process. So it can be really daunting to have to participate in a polygraph and some of the other background components, and the recruitment staff are mentoring them through that process. And that's really kept people in the game faster. And then the last thing we did that has been very successful for our jail is a conditional offer of employment right from the very get-go. So we've kind of changed the order of operations. It used to be that you didn't get that till pretty much very late into the process. But if you can do a conditional offer up front, then you have people who are invested in your agency when there is a lot of competition to go to other places.
Excellent. Thank you, Devin. I heard somebody talk about, recruitment efforts refers to just opening up the door and letting somebody come in and see the operations. I went to some training at Western State Hospital, and I was told that these new employee orientations happen every month, and they have 35 plus people every single month. And they told me by the end of the year, over half of these people will no longer be working here. And so I asked them, what did they do for strategies? And one of the things that they had mentioned was they go through a whole month of new employee orientation. And as soon as they're done being trained, then they put them on the ward, and then they quit within the first night because, nothing was like the training. The real thing was like eye opener. And they said, no way in heck are we working here. So these new employee orientations now, instead of, going in and doing all the training up front, that they are taking some time and being part of the new employee orientation is letting them go in and maybe talk to some people already in the profession and have a chance to let them see the place that they're going to be working. And this certainly will help them either make sure that they're not wasting their efforts in training people who are just going to quit, but knowing that people know what they're getting themselves into and are probably going to be better students.
There was an inquiry. I would be interested to hear what the average wait times for academy are. If anybody just has a number that they can throw out that they've been experiencing.
So I can tell you with some restructuring in the CJTC, it's a hard number to give right now, but and Devin can back this up. But earlier this year, I want to say it was over a year and up to almost 2 years in some cases. But they've since fixed that with some guidelines for smaller rural jails being able to have spots saved in the Burien class. But they've also opened a class in Southwest Washington at the regional jail there, or the regional academy there. First class is going right now, and Spokane's opening a regional jail academy starting July 1st, next Monday. So we're starting to see some alleviation on that, and there's been quite a few positions hired, so it's kind of hard to give a more accurate number right now because they've made some changes and we're getting people in and we're utilizing other parts of the state. So I think this last one, they told me we're down to almost 12 months, which is a lot better than the 20 months we've been at. So,
Wow.
Thank you, Ed. Wow.
One of the things that when we talked about people having all these vacancies, a lot of people were being very creative out there in the facilities that I was able to witness. And some of the things that they're using, police officers are used to assist during staffing shortage. Police officers are required to start off in the jail for 30 days to 6 months before they transfer out to the streets. In some jurisdictions, they have rotating police and correctional duties. So you'll do 9 months as a road deputy, and then you'll be going back into the jail. So you go back and forth. So you learn both jobs. We also have police officers. We offer police officers overtime to assist in the jail, and we're seeing that. And then also police officers are assisting with transports and standby while facility officers address jail issues. But unfortunately, police officers are also are running into recruitment and retention issues as well. So police officers may or may not be available. Another thing is how we're running our control booths. A lot of places are hiring civilian control booth staff, plainclothes, that they're just hired to handle control booth duties. They have no contact with the population. And if something needs to be addressed, then they either call an officer, or in some cases, they need to call a law enforcement in to the jail, so this person can be dealt with. And then there's also folks that are doing not only control booth work, but they're also they're the dispatch officer. And so they're hiring a person to handle both of these functions. And then we heard earlier that this is more of a curse, but roving nurses are utilized to provide health services in multiple jails. One of the things they mentioned in Philadelphia at that ACA conference was create a mobile corrections officer team that would travel to sites with multiple vacancies. I don't know how that would look with all their different county jurisdictions and city jurisdictions, but it's a thought. Another thing, because mental health folks and other people to help assist with the population aren't available, some jurisdictions are finding peer counselors or navigators are a helpful resource. They're able to talk with the population, help them deal with coping strategies, help them with support, and actually giving them some recommendations for reentry and validating what they're going through. And so we're seeing facilities utilizing these peer counselors. Also, taking a look at your policies and procedures. A lot of policies and procedures are based on staffing levels. And if you don't have the proper staffing levels, are your policies even doable? Are they safe? And so take a look at your policies, and are they, do you have the correct amount of staff to actually achieve your policies and procedures? And then one of the things that I saw a lot of it was jail leadership, commanders, lieutenants, sergeants. Everybody is taking a position as a line staff. They're working shift work. Sometimes when I was doing my visits, certain people weren't available because they just got done pulling an all-nighter shift. And so that's very real, where the command staff are actually doing shift work. Are there any other strategies that people are using to address staff shortages while I have this up?
I do have one other one. Last summer, we were able to help another jail because of their critical staffing shortage. So mutual aid agreements between jails is always a good plan, just in case there's some unforeseen emergency. And then as a last resort, but in order to provide a safe facility, you could always consider booking restrictions as a very short-term strategy, but just two other options.
Excellent. Yep. And I noticed that a lot of the rural jails have contracts with each other to hold each other's residents and help out with transports. Yes. Thank you. Okay. Retention strategies. These are some of the things we talked about. Raises. Utilizing funds slated for vacant FTEs are used for raises for existing personnel. Some places, well, if we can't hire folks, maybe we can use some of that money to give raises. We also talked about flexible shifts as a recruitment strategy. It's also a retention strategy. Look at the 12-hour shifts, the 410s, the 980s. Allow staff to trade shifts as needed. Or maybe you can offer a reward or incentive for staff or having to work a less popular shift. Staff wellness and mental health is becoming a top priority in the places that we work. New jails are being built with staff in mind as well as the population. Break rooms for staff outside of the jail. Allow your staff to get out of the facility and take a break, and having a break room outside the facility walls sometimes can be very helpful and beneficial. Make sure that, yes, we all have mandatory break times that we're supposed to be doing, but allow the adequate time and make sure people are taking their breaks. When we're having incidents, I think everybody can agree that debriefing is crucial, but oftentimes we don't have time to do it. Take the time to do it. A lot of people learn from that. They benefit from it, and it helps them with how they're coping with it. CISM teams, crisis intervention support members, I think it's what it's called. Basically, they're a team of our peers that can help debrief people with critical incidents to help them deal with things. Offering administrative time off following a critical incident, and then just check in with staff routinely. Have a complete fitness facility at your jail. Some places have a shooting range, or they even offer a gym membership to a local fitness club, or maybe even start your own fitness club. Have a step challenge. Have a contest of who can get the most steps. But yeah, a lot of folks are starting these wellness programs within their facilities. Sometimes budgets are an issue, but try to offer continual training to enhance professional development. And then facility-wide communication and collaboration. Ask yourself, what does my staff think about their working conditions? Seek staff input. Allow staff to be heard. Ask frontline staff how they might improve their roles. Maybe put up a suggestion box. Include all job classifications when you're doing staffing. I've seen a lot of successful programs in the state, and they're successful because they collaborate with all entities in the jail. You got custody, you got mental health, you got health services, you got classification. You even have members from the community all collaborating together when they're staffing different cases. So have an inclusive group of people that you collaborate consistently with. And then another thing is conducting cultural audits in your facilities to look at culture. You maybe conduct surveys, exit interviews. Why are people leaving? Ask them. And don't be content of living with the status quo. Be willing to make changes and mix things up if you have to. And this last thing I'd like to talk about is conducting a cultural audit for your facility and revisiting mission and vision and values. Creating a clear facility vision, mission, and value statement can be very beneficial. It can be quite laborious and sometimes not successful, but if it is done the correct way, it's a great way to get staff buy-in and collaborate with everybody that works in your facility. I want to take a moment and I'd like to share one with you that I was able to find online. Okay, this is an example of a mission, vision, value statement that was taken from the website of the SCORE jail. Devin, I'm going to put your process on Front Street here. And the thing is that a vision mission statement doesn't have to be lengthy, but it just needs to be a clear message on what your facility stands for. Involving staff in creating it will help them buy into what it is that you're trying to do. So basically, the SCORE mission statement is to provide the highest quality public safety service to those we serve. Pretty simple, but straightforward. Vision, dedicated in creating an environment of public trust and excellence through all layers of services, enhancing the field of correction with integrity, innovation, and commitment. And then they list a few values that are important to the facility. You got service, you got excellent, respect, collaboration, and diversity. And you can read a little bit about each one of those values. Devin, you mentioned that this was a process in developing this. Can you maybe touch on what that process looked like and how it's helped your staff in your facility?
Yeah, we used a consultant, but we had our consultant meet with every employee at SCORE and solicit their input. And this is only our second mission and vision in the history of SCORE. So the first set was just fine, but we'd outgrown it, and employees were not included in that process. So this was our opportunity. We did this in the middle of COVID to just remind ourselves why we were coming to work every day and what kind of work we should be doing while we're here.
Excellent. Thank you. When I worked for the Department of Corrections, we went through a long process. We had the whole agency, prisons, community corrections, correctional industry, you name it. We all participated in putting together a mission, vision, and value statement. We worked hard on it. We came up with something. It was rather lengthy, but we all felt proud. We all put it together. And then we had a secretary come in, and he thought it was way too long, and he changed it himself and basically said, this is it. And yeah, it was a short mission. I think it's, it was snappy. You could remember it. You could put it on a button, but staff weren't part of making it. It was kind of rammed down their throat, and it was a kind of a contentious topic for a long period of time, that all this work was done, and then it was just thrown out the window. A new leader came in and made his own mission. So if you decide that you do this, it's only going to be effective if you collaborate with those that you surround yourself with at your facility, the ones that do the work. Okay, thank you.
Are there any of the retention strategies below that you've tried? Are there other things you've thought about or maybe have already implemented as far as retaining folks?
Obviously, raises is a big one. It's a union contract for us. In fact, I was having this conversation with our union guys this morning, and it's a huge one because the cost of living has gone up depending where you are. It's crazy to think that my mortgage on my 2,800 square foot house is less than rent for a 2-bedroom apartment in Ellensburg now. And so that's a huge one, and that's something you have to consider, but it is also a tough one, finding that fine line when doing your budget and processes. The flexible shifts, I've already hit on that. Not as much flexible as rotating. Staff wellness and mental health. We've put together a peer group, and it's been used regularly. They're getting all the right certifications through the state, but then also, there's grant funding out there, and with that, we've gone to the employees and asked for things they've wanted and so forth. So that's, where we develop that communication piece, and it falls through the next three is all the way from the top down. It doesn't matter if you walk by the superintendent's office, my office, the other lieutenant's office, you're stopped, you're asked how things are going. We go in there daily and check in, just so they don't know that they have a say. And when we're building a program, this is something big. As people know in my life, when I'm building the program, I've got the idea, but I don't run it. So I make sure to get anybody that's got boots on the ground and get their direct input, because not only does it give a buy-in and sell the sizzle, but it's the opportunity for you to make sure that you're doing things off and not driving employees away. So that's a huge piece.
Excellent. Very good. Thank you very much. I told you about some research on our JTA website. There's the link, and then there's also the QR code. These are some of the articles that I have that are on there. All good stuff on helping you with retention and recruitment. And so you can always contact me at any time, and I'll do my best to help you out. So with that, I thank everybody for joining us today. Take care now. Bye.